Welcome. My name is Sandro Galea. I serve as Dean of the WashU School of Public Health. Welcome to Public Health Ideas. Today, I have the privilege of speaking with Dr. Patrick Aguilar. Dr. Aguilar is Professor of Practice of Organizational Behavior and Managing Director of Health at the WashU Olin Business School and a secondary faculty member in the School of Public Health. We're going to be discussing better approaches to using business to improve health. Patrick, welcome.
Thank you.
So let's start with your trajectory, your background. What you do is unusual. Tell us a little bit about how you came to be doing the work you're doing.
Yeah, thanks for having me. I'm excited about the conversation. I became a physician right out of college, went from college to med school. And the reason I did that was that I was absolutely entranced by the magic of doctor-patient interactions. Now, I know that sounds goofy and like something you might write in a med school application essay, but I actually remember the moment when I was shadowing a surgeon as a freshman in college and really was just taken at how connected patients and doctors had to be to get the work done. And I felt like I needed to understand that. So fast forward through medical training, and now I'm a practicing physician, and I realized that what I had been interested in medicine also made me interested in the kinds of interactions that happened within organizations. And although I knew how to take care of patients, I'd become a pulmonologist and a transplant pulmonologist and a medical intensivist, I didn't quite understand how to have the kinds of conversations that would help business strategists and financial decision makers align with what we knew on the front lines. So I went to business school to try to learn those things. And during the course of my experience at Olin, getting an MBA, I really came to connect closely with the types of things being taught in organizational behavior and strategy classes. And I started to think about how much that matters on the front lines, how much that matters to doctors and nurses and healthcare professionals across the industry who have to deliver great care to patients every day. So I went back to the School of Medicine and said, we should teach this more, built some content, built some opportunities for faculty, resident, and student development, and was perfectly content sitting at the intersection of academic business and medicine. But then I had an opportunity to go do more exploring on my own, and I became the chief medical officer for Quick Trip, which is a large convenience retailer that operates across the country. In that role, I led a startup and also led the employee health plan for the company. From there, I was recruited back to a health system and got to be the chief pulmonologist for a large health system that was in the process of actively merging and acquiring new practices, and learned a lot about exactly how business decisions translated into operational realities for people on the ground. Then, out of seemingly nowhere, I had this opportunity to teach at Olin, and I became an adjunct professor and started teaching classes and absolutely loved that. And that led to working with Dean Mazzio shortly after his arrival and thinking about how Olin could do more to impact health, and then a role leading those efforts to do exactly that. After the dean started, he launched a new strategic plan called All Together Now, and a key element of that is thinking about how Olin can become a better participant in the health industry, developing leaders out of our students, and further developing leaders in the community to improve the health and well-being of individuals and societies. And I feel really lucky to have that job. It's an absolute blast.
That's a really interesting journey. Tell us a little bit about, now let's move into the content of the job a little bit. So let's talk a little about business and how it intersects with health. And I'm interested in your thoughts about business and health, and in particular also to elaborate on broader forces that generate health in conjunction with, but perhaps in contrast with healthcare. Tell me where you're at in your evolution, you're thinking about that.
Yeah, it's a great question, and it's a challenging one, of course. Mm-hmm. When I think about the spectrum of who's working on health in the academy, I respect the way that public health schools think about populations and the ways that populations can be healthier. I respect the way that medical schools and bioscience groups think very closely about individual specific conditions. And I respect the way that business schools think about how to make those kinds of innovations on both ends really become pragmatic realities. Now, it's not that simple. There's obviously a lot of overlap in the considerations of these three groups of academics, but the reality is business is the mechanism by which the good ideas we have come to bear. And that's the place that I get to sit, is thinking about how do we improve the way that we leverage business insights from the academy and from pragmatic realities in industry to try to make things better for people.
Let's be concrete. Can you give me a couple of examples where you have seen business integrating with health, creating value for everybody, creating a better, healthier world?
Yeah, absolutely. The one that I'll talk about first is the Quick Trip Health Plan, because I got to be a part of that. Yeah. This is a private company that decided that it could do a better job managing health benefits than its third-party administrator was doing. And so they developed a benefits program where they fully self-insure and self-administer this health plan. They built relationships with large health systems in each of their markets. And they developed a relationship that meant that the health system knew that they were going to pay the bills on time. And they knew they were going to get a high quality, high value service for their members, which is their employees. And as a part of that, they manage the balance of premiums and claims, just like any insurance group would, but they do that in a way that is respectful of the interests of their employees and respectful of the needs of the business overall. Now, on the surface, that doesn't quite sound like a business innovation, but the reality is they lowered their own costs, they lowered the costs for the employees, and they were able to secure higher value, higher quality care for quick trippers across the country. That's an amazing innovation. Yeah. I also think about GoodRx. GoodRx is a financial model, really. It's a group of people that aggregated discounts that were available to pharmacy benefit managers and provided millions of patients every year with the opportunity to take advantage of those discounts when insurance isn't enough or not available. Innovations like that, both within companies for the health of their workforce and by companies looking to make profit, but also to make things better for patients, are really abundant. And you can see lots of those examples across sectors in the health industry.
Let's talk about profit. I feel like in the population health conversation, we often get stuck on this. We get stuck on the fact that the private sector business has a clear profit motivation, which sometimes is in conflict with a more mission-driven motivation for those who are more public sector health. How do we align generating a profit that is a term which I've used in my writing, sort of healthy profit, that we incentivize companies to, yes, work within their parameters, but make sure that the profit generation doesn't misalign with the goal of creating health?
Yeah, this is a really important discussion and a big part of where the tension comes between business leaders and others who think about health. The main way that I think about this is through the lens of what is the right responsibility of business, what is the right responsibility of government, and what is the right responsibility of society. Business will follow the behaviors of society vis-a-vis customers. And so if the market, the customers, the society shift their expectations, business will follow that. At the same time, in most cases, business will follow the rules. And what I tell students in my classes all the time is if you think something is wrong in healthcare, there's two options. Either change the way consumers engage with that or change the way the government has written the rules. And the mechanism we have for that is voting. If we're unhappy with a structural setup within the system, politics and policy making are the way to fix the rules that will change business behavior. Of course, people will break the law. That happens in all kinds of ways. I won't ask you how fast you drove to work today. But it's worth noting that most people, most of the time, generally follow the rules. And that's a key lever that society has to change the way that business will operate as it plays by the rules to try to generate the profits it needs.
That's actually a really nice way of thinking about the rules and the mechanisms we have for changing the rules. Let's talk about responsibility, because you mentioned responsibility, and let's move to corporate social responsibility. So lead us through, first of all, frame for us what the whole set of corporate social responsibility, CSR activities means. And what do you see are the actual goals of well-functioning CSR activities?
Yeah. You and I have talked about this in the past in the terms of what words mean. And so your first question is the important one here. Like many terms in modernity, we've taken the term corporate social responsibility and shifted it to mean lots of different things to lots of different people. The way I'm going to talk about it right now is really a focus on long-term value creation, both for shareholders and for stakeholders, which are not the same groups of people. Shareholders own parts of the profit, and stakeholders own parts of the outcomes of the work. When we think about corporate social responsibility, let me say that differently. When I think about corporate social responsibility, I think about the responsibility companies have to think long-term, to focus on what's coming past this quarter and what will happen in the longer horizon. Now, again, we get to the place where businesses cannot alone be expected to change the way they behave solely because something sounds like a good idea. Ultimately, investors have to want the horizon of focus that makes sense for them, and the companies respond to that. Sounds a little messy, but ultimately, if you've got a group of investors that's willing to think on a 5-year time horizon, the company is much more able to think about what will be value creative or value destructive on that time horizon. If investors are moving day to day, it gets really hard for companies to try to imagine how do we generate long-term value. Now, again, we get to the place where society and the government sets the stage for businesses to behave how they do. Systems don't generally produce outcomes vastly deviant than their construction would suggest that they would. And when you look at the way that investor behaviors have been in recent years, and when you look at the way that different financial innovators have changed the way that investments look, you start to see some of this short-term focus make more sense. Not more sense in that it's what should happen, more sense in that it's what is happening. And so we have to get to a place, if we want to see a longer focus on value, a value that's respectful of climate, a value that's respectful of community health, and a value that's respectful of where the shareholders' value will look in 10 years, we have to get to a place where the structures that support businesses doing what they do generate that kind of outcome.
I really like your clear distinction between shareholders and stakeholders, and I like the notion that, I guess, a thread to what you're saying is to align those interests for shareholders and stakeholders. Right. Let me ask a question. It's a little bit adjacent, but I think it's a really important question. One of the concerns, I think, about the work of business for those in health is that business cares less than health might about health gaps, health inequities. Sure. There is, almost by definition, the consumers of business are those with resources, and those with resources have better health. So what do you see is the place where business can intersect with let's call it the other goal of health? The goal of everybody in health is to improve health overall, but it's also to narrow health gaps. So how do you see business intersecting with that goal? Yeah. When I give this soapbox talk I have called Why Business Matters to Health, I talk about 4 key things. I won't talk about them all here, but I'll mention that care delivery innovation and biotechnology innovation are absolutely critical measures of how business changes health. GoodRx is an example of that. Developers of new drugs, devices, technologies are examples of that. When it comes to the question you're asking here, I think about the other 2, and those 2 are economic impact and workforce health. Economic impact is the idea that when a company makes movements in a region and that movement starts to generate changes in the local economy, that has the potential to be valuable for everybody in the community. We see this through the globalization experiences of the last 30, 40 years. I'm not saying it's all been perfect by any means, but we see that when companies move in and raise the economic standards of living, there's the ability to buy new things that didn't exist before. If you try to think about that in the inverse, you can look at what happens when corporations leave a town and how difficult it is for people to afford the resources they need. I think about this saying that's not at all related to health: retail follows rooftops. I think about that a lot. Retail companies don't normally move into an empty area hoping people will come. They move into an area where people are. And the same is true for physicians, for hospitals, for health services. Those types of organizations generally do not show up where there aren't already resources. So a key lever for businesses to impact health and to improve health equity is to generate a positive economic impact, which is their main mission. Now, that doesn't advantage everyone immediately, but it's a start. And to that end, it's the right role of the business and doesn't put too much on the business for what it's responsible for. We as a society have responsibilities, and businesses are one part of that. The second piece is workforce health. That's obviously been a big part of my own personal experience. And I'm reminded of a comment Mark Cuban made at a roundtable of CEOs about a month ago, where he said, healthcare is complicated because of you all. You all have signed contracts with health insurance companies that you didn't understand and you didn't pay attention to. Now, I'm quoting Mark Cuban, not directly, but sort of indirectly, because I don't want to accuse anyone of that, but he can. And the reality is we, in the business world, have not paid enough attention to the kinds of contracts and the kinds of agreements that make up 52% of Americans' access to healthcare. I spent a lot of time at Olin talking with business leaders and with students who want to run businesses about the fact that if you are in that position, you are one of the largest purchasers of healthcare in the country. And ultimately, business leaders, are stakeholders that are really important. They are very often the proximate customer. If the movement among business leaders was towards better opportunities for their employees to access health, that would change the behaviors of payers and it would change the behavior of providers. I have innumerable examples of that, and there are business health coalitions around the country thinking about it. But those are the 2 things that I think about when I think, how could business really make a difference? Yeah, the latter point is really interesting. I've often wondered why it is that the business leaders are not more vocal about the need for aligning healthcare towards the end of creating better health for both their employees and for communities. And I think what you're saying there is in some respects, it's not understood that they even have that leverage, which is interesting. Just let me change tack for a second. Tell me a little bit about how you see business working with government, not-for-profit, let's say public sector, towards a shared goal of creating a healthier world, narrowing health gaps.
Yeah, this is going to be a little Pollyanna, I'll admit that. But I think that the first step has to be a low stakes step, because this is a big ask. And the first step in my mind has to be getting people together to have conversations that might be uncomfortable, but that are fair and where everyone's voice counts equally. I've recently heard someone say, if we don't invite business to the room, how can we let them know what we don't like about what they're doing? That attitude is the wrong kind of attitude to enter into an agreement or to enter into the process of trying to align values and come up with shared wins. The way that we should approach this is groups of people that wouldn't normally sit together having conversations that aren't accusatory and where nobody's trying to put anyone else on the defense. That goes both ways. Business leaders have the tendency to do this too. Getting people together in a room to think about what we would like to see, and then asking them to think pragmatically about how they could take one step closer, is a very important movement towards us developing aligned goals that actually lead to the outcomes we all want. I've known executives in all kinds of companies, ranging from convenience stores to healthcare firms to pharma and biotech and the like. And what I can clearly say is most people, whether physicians or nurses or business executives, generally want good for their neighbors. The problem comes when we have constrained conversations based in our historical disagreements, and we don't open the language to be more inclusive of where we might find alignment. Anytime I've ever led a team that had an internal opponent or even an external opponent that we were working against, if I wanted us to reach a shared space, the starting place had to be, let's just talk. Let's listen to each other. The School of Public Health at WashU and Olin Business School have both started the process in this year of curating really wide-ranging conversations that bring together people from different backgrounds. I think that's where it starts. The more that happens, the more likely we are to find alignment on the simple things. And as low-stakes wins start to happen, we set the stage for larger stake wins overall.
Well, that was both well said, but also, I wouldn't say Pollyannish. It was realistically aspirational. I really like that. Tell me, before we start winding down, what do you think is the biggest obstacle that business might face in terms of being part of this conversation, in terms of being part of a conversation where we can align the goals of business with the goals of health?
Yeah. When I think back to my time as a hospital administrator, such as it was, I remember all of the things the hospital was asked to do. I've heard the same story from people in public education. All of the things that the school district is asked to do that reach outside of what's in their capability set or their real set of responsibilities. But people are frustrated with how things are going and want solutions. And so they go to the people who will listen and say, do more for us. I think that kind of thinking is the kind of thinking that leads us to a really constrained and obstacle-ridden course forward. Business can't solve social ills. Business can't make society better. Society has to decide what it wants to be and construct a path through which it can generate rules that govern all of our behavior and that shape the way business is practiced. If the rules of business are designed, I talked about systems producing the outcomes they're intended to produce. If the rules of business are designed to produce one type of outcome, it's going to be very difficult for business leaders to take a moral stance that moves away from that. It's just hard when you've got shareholders, when there are people watching, when you've got metrics you have to follow. On the other hand, if we as a society want to see change, advocating for the kinds of change we think will be beneficial, agreeing through open dialogue, and then creating these opportunities to create alignment, those are the ways to start to get a different set of rules that helps businesses perform in the way that match those kinds of expectations.
You keep coming back to this, which I really like, which is the notion that ultimately business are one sector. It's one sector, a set of players operating with a set of rules, and it is on society to set the rules.
Right.
And you said something about it's on society to try to find a conversation, to find what we want to be. I actually couldn't agree more. And in part, in some of my thinking, I've often felt the most important thing we can do in health is to shape the conversation that shapes the rules society makes. Now, I think a criticism of that is that there's cynical manipulation of the let's call it the social conversation. That's fine, but one can only hope that most of the people, most of the time, are committed to a conversation that sets the rules in a pro-social way. And within that, business operates.
Yeah, I think that's right. And I think the cynical view of people advocating to entrenched self-interests will be true on all arenas. There will be lots of people in any conversation advocating for the status quo. And it's up to us to find those low stakes agreements and gradually build to higher stakes agreements that make things better.
Let me ask you, it's a little bit of an adjunct question, but let me just ask you, let's talk about technology for a second. You and I are talking 2025 and the cusp of the AI revolution, such as it is. And I always worry about, when I talk about technology, that we have a human instinct to say, well, it's going to solve everything, or it's going to be the end of everything. And it seldom is. Technology is always sort of an incremental step. Where do you see technology in this conversation right now, at the nexus of business and health?
Yeah. This is a fascinating space, and I won't blame you for asking me to take a position on AI in 2025 that will certainly be wrong by the beginning of 2026.
I'm just trying to have you on record, that's all.
There you go. When I think back to the printing press, not that I was there, but think back to the advent of published material, I think about how human beings who previously didn't have access to information got access. When I think about AI and its capabilities, I think about the same kind of thing for ways of thinking. It's not just information anymore, it's interactions and dialogues with the information that produce new insights for people. And that's really exciting on a couple of levels. On one level, it means that we will have a differently influenced healthcare consumer. It means that people will be able to have thought through things in more detail and started to ask questions and develop understandings that they bring into their consumerism within healthcare and within their broader health. On the second level, it's exciting because it means we'll be able to start to understand what people are thinking through the lens of how large-scale data signals their behavior. The best signal about what someone thinks is what they do. And when we can use large-scale data analysis in really sophisticated ways, we can understand sentiment a lot better. Now, those two exciting things do not come without anxiety-provoking things like who will be programming the AI that people use to get that, and how might we misuse the data. This is where those social conversations become all the more important. But I'm very excited to see people be able to engage more effectively, be able to ask better questions, be able to develop new insights that they may not have previously had access to because there was voluminous information, but it wasn't necessarily presented in a way that was accessible to them.
We'll check back in a few months.
Yeah.
You and I have the privilege of working in a university. What can we do in universities better in order to catalyze this conversation that we're talking about aligning business, the goals of business with the goals of health? How should we in universities turn a mirror to ourselves and say, what should we be doing to do things differently?
Yeah. You're on the immediate edge of me thinking about this in my own classroom. Years ago, people started talking about the flipped classroom approach, and we should give people things to read and then come to class and have rich dialogue. That's never been more important. And it's never been more important to ask students to read and think on their own and then come and enter dialogue, and to have a role model and a faculty member who develops rich conversations, who helps people find their voice, and who guides people to have civil discourse, to disagree, to think broadly, and to connect with each other in ways that a lecture could never accomplish. So what I'm doing, I'm not saying this is the right thing or that I'll be great at it, but what I'm doing is moving very heavily towards case-based discussions with pre-readings to expose students to content. Students no longer need necessarily or want us to provide them with direct content. They want to think about how to apply it because they can get a brief summary of the entire lecture by just loading it into ChatGPT and getting a readout. And so my job now, in my mind, is to guide students in the very process of these debates and dialogues. I tell them at the beginning of every semester, if you turn in something from AI, I may or may not know, but you have to wonder if you could just in 30 seconds generate an AI output, why can't your boss do that without you? The thing that we have to help students do is develop the capability to engage thoughtfully in human ways that, as of yet, AI is not doing, and to have conversations that depict their value, not their intrinsic human value, but their value to the organization, and do that in a way that makes them stand out. And when I say students, the person a lot of folks listening to this might be picturing is 18 or 19. But when I say students, I'm also thinking about people like me who got an MBA in the middle of their career, people like both of us who sit through educational seminars from time to time to continue to advance our awareness, the university can no longer be just a place for young students. It's got to be a place for all of us to be able to have safe conversations with facilitated dialogues to advance our understanding of how things could be. All of the conversations you and I agree are the right places to start depend on humans' ability to do that. And the university has a really unique opportunity right now to be a leader in helping guide that.
So I'm taken by the way you started this answer by saying this is on the immediate edge of your thinking about it. And it feels right to me that what we should be doing in universities more is teaching students how to think rather than teaching them what to think. And I like how you are seeing the role of AI in helping students learn to think. So we'll revisit that as well, but I suspect that one's right. Last question, hope. Tell me about hope. What gives you hope in the moment?
Humanity gives me hope. And I feel like I'm giving all these answers that sound like essays that I might have written to get into some program, but humanity gives me hope. And when I say that, what I mean is I get to spend time with people who are thinkers from across life cycles, from across industries, from across roles. And I get to hear their excitement, whether they're students in my classrooms, whether they're patients I see in clinic, whether they're executives I'm working with on projects. People are looking to make things better. And as we've both said in this conversation, most people, most of the time, want things to be better for their neighbors, and they're thinking about how to do it. I'm hopeful because that intrinsic desire that feels so connected to our lives as human beings is an incredibly important ingredient for the recipe that gets us to things actually getting better. That gives me hope, and it gives me hope every time I get to do it with a student, or with a patient, with a colleague, with an industry executive, get to learn about how they're thinking and how they're moving, and then get to help facilitate conversations between those groups of people.
Patrick, thank you for talking today. Thank you for everything you do.
Thank you.
Thank you for joining us.